Herpes simplex virus. Herpes simplex is a contagious disease which is transmitted by direct contact and the sexual intercourse. It is caused by a double stranded DNA virus which is termed as herpes simplex virus. It is of two types: herpes simplex virus 1, which infect the area of the body above the waist mostly, where the herpes virus simplex virus 2 affect the area below the waist, that is mostly the genital area, that is buttock, anal, vaginal, scrotal, penis, and that is all the genital area is infected by this type of virus. That is type 2 virus. In this disease, which is transmitted only by direct contact and sexual intercourse and is not transmitted by droplet infection, but it is put in the category of contagious disease. The virus enters through the cracks, fissures, pores in the skin and mucosa of the body in the various organs. The type first causes the disease which is termed as orolabial or facial disease, while the second is termed as genital herpes. In the first type, there is appearance of the red, painful blisters in the form of clusters inside the mouth, over the tongue, lips, pharynx, larynx, tonsils, palate, in the oral cavity. In addition to the oral cavity, outside in the face, near the lips, especially around the eyes, ear, and the cheeks. Because the virus, which is transmitted through the fissures or deficiencies in the skin and the mucosa, that passes through the sensory nerve endings in the surrounding, that goes and travel up to through the axons into the sensory ganglions of the central nervous system. So there is replication of the virus in these sensory ganglions located in the brain. The increase in the number of the viruses occurs and then travel again outside through the sensory axon towards the skin and the mucosa of the various organs. There it produces blisters that passes from macule, papule, vesicles, pustules, and later they end in the ulcers and heal up, and then it is shedding in the form of crusts. The incubation period is from 5 to 7 days. The course of the disease is from 2 to 4 weeks. As it is a viral disease, there is no proper cure and treatment of this disease. Virus once get entry in the body remains in the body in dormant position by the action of the immune system that tries to kill the viruses as maximum as possible, but the remaining viruses, they undergo dormant position in the sensory ganglions, and they may reactivate at any time when the immune system of the body is declined. Now, prodromal symptoms are there is burning, tingling, numbness, and pain in the affected area before the appearance of the blisters, the pimples. When the pimples or the blister appear in crops shape or in the clusters, that is a very horrible position and painful very position to the patient, and then passes into various phases and end into the crust. When there is shedding of the crust, it means the patient is almost asymptomatic. But there is no proper cure of this disease. There is no vaccination up till now. So only preventive measures are required to avoid from this disease.